Constantly passing gas can often be a sign of certain digestive system-related conditions. These conditions may include: Number 1. Lactose intolerance. Lactose intolerance is a condition that occurs when lactose, a sugar in milk, is not digested. The digestive system does not have enough lactase enzyme to break down lactose. Therefore, people with lactose intolerance cannot digest milk and dairy products. Lactose intolerance is often due to a genetic predisposition. Some people begin to produce small amounts of lactase enzyme as they age, or due to other reasons. In this case, digesting lactose becomes difficult, and the digestive system reacts with symptoms such as gas, abdominal pain, bloating, diarrhea, or constipation. Symptoms of lactose intolerance can vary from person to person, and symptoms usually occur after consuming lactose-containing foods. Lactose found in dairy products such as milk, cheese, yogurt, and some processed foods can cause symptoms. The diagnosis of lactose intolerance is usually made by evaluating the symptoms. Doctors often recommend avoiding lactose-containing foods for a certain period and observing whether the symptoms improve. Additionally, some tests can be done to measure lactase enzyme levels. People with lactose intolerance can manage their symptoms by avoiding lactose-containing foods. However, completely cutting out dairy products can lead to deficiencies in some nutrients, so it is important to have a balanced diet. Some people may use lactase enzyme supplements to increase lactose digestion. Choosing lactose-free or low-lactose products, such as alternative milks and dairy products, can be beneficial. While lactose intolerance is generally harmless, the symptoms can be bothersome. If the symptoms are severe or affecting your quality of life, it is important to consult a healthcare professional. Number 2. Celiac disease. Celiac disease is an autoimmune disorder characterized by an extreme sensitivity reaction to a protein called gluten in the intestines. Gluten is a protein found in wheat, barley, rye, and some types of oats. This protein can cause damage to the intestinal wall and hinder the absorption of nutrients. This disease has certain symptoms. Some of them are as follows: abdominal pain and cramps, bloating and gas, diarrhea or constipation, vomiting, skin rashes, weight loss, fatigue and weakness, iron deficiency anemia. It is diagnosed through methods such as blood tests and intestinal biopsy. Treatment involves avoiding gluten-containing foods. Maintaining a balanced diet with gluten-free foods is important. Supplements can be taken to address vitamin and mineral deficiencies. Regular health checkups should be conducted. If left untreated, celiac disease can lead to serious health problems, so it is important for individuals with symptoms to consult a healthcare professional. Number 3. Irritable bowel syndrome. Irritable bowel syndrome is a common digestive disorder. Abdominal pain, bloating and gas, constipation, diarrhea. IBS is usually a chronic condition, but is not a serious health problem and does not cause permanent damage to the intestinal tissue. Stress, hormonal changes, and certain foods can also trigger symptoms. Diagnosis is usually based on evaluating symptoms and the patient's medical history. Treatment typically aims to alleviate and control symptoms. Dietary changes, stress management, medications, and sometimes psychological support therapies can be used. It is important for individuals with IBS symptoms to manage stress, engage in regular exercise, and maintain a healthy diet. It should be noted that certain foods may trigger symptoms, so avoiding or reducing these foods may be beneficial. Irritable bowel syndrome can affect quality of life, but generally does not lead to serious health problems. It is important for individuals with symptoms to consult a healthcare professional to develop the right treatment and management plan. Number 4. Digestive system infections. Digestive system infections are conditions where bacteria, viruses, or parasites cause infection in the digestive system. These infections can affect different parts of the digestive system, and symptoms are usually mild to moderate, but sometimes can be severe. Symptoms: diarrhea, constipation, abdominal pain and cramps, nausea and vomiting. Fever, fatigue causes bacteria. Bacteria such as Salmonella, E. coli and Campylobacter can cause digestive system infections. Viruses like norovirus and rotavirus can lead to digestive system infections. Ferricides such as Giardia lamblia and Cryptosporidium can cause infections. Diagnosis is usually based on evaluating symptoms and the patient's medical history. Treatment typically aims to alleviate and control symptoms. Medications, fluid and electrolyte replacement, and rest are often recommended treatment methods. Frequent hand washing, consuming clean and healthy foods, and adhering to hygiene rules are important in preventing digestive system infections. Vaccination, especially against specific infections like rotavirus, can reduce the risk of infection. Digestive system infections are usually treatable at home, but in some cases they can be severe and require intervention by a healthcare professional. It is important for individuals with severe symptoms to consult a healthcare professional. Number 5. High-fiber foods. High-fiber foods are rich in fiber, which is an indigestible plant substance that is important for digestive system health. Adequate fiber intake can reduce the risk of constipation, diverticulitis, hemorrhoids, and digestive system cancer. Whole grains like whole wheat bread, brown rice, and oatmeal are high in fiber. Vegetables such as peas, broccoli, carrots, and spinach are rich in fiber. Fruits such as apples, pears, and oranges are rich in fiber. Fiber regulates bowel movements and can prevent constipation. Fiber slows digestion and prolongs the feeling of fullness, which can help with weight control. Some fibers can lower cholesterol levels, which is beneficial for heart health. Fibers can help keep blood sugar levels balanced, which can reduce the risk of diabetes. Needs attention. Rapidly increasing fiber intake can cause digestive problems. It is important to increase fiber intake gradually. Drinking enough water can help with the digestion of fibers. For a healthy digestive system, it is important to pay attention to daily fiber intake. In general, adults are recommended to consume at least 25 or 30 grams of fiber per day. Fast eating typically refers to eating quickly, often in a rushed manner, and without chewing food thoroughly. This habit can be harmful to digestive system health and may lead to some health issues. Eating quickly can lead to insufficient chewing of food and not giving enough time for digestive enzymes to break down food. This can lead to digestive issues, gas, and bloating. Fast eating can delay the feeling of fullness, which can lead to overeating and, consequently, contribute to weight gain. Eating quickly can cause the stomach acid to overwork while digesting food, which can lead to stomach discomforts like heartburn. Eating food quickly can prevent the body from fully absorbing nutrients, which can lead to nutrient deficiencies. The habit of fast eating can increase the risk of chronic diseases such as obesity, diabetes, and heart diseases. It is important to develop a habit of eating slowly, chewing each bite thoroughly, and allowing enough time for digestion. Planning meal times without rushing and eating in a calm environment can facilitate digestion. Opting for smaller portions and having more if needed can reduce the tendency to eat quickly. Drinking enough water during meals can support digestion and increase the feeling of fullness. Be mindful of your food choices and opt for healthy and nutritious foods. Fast eating can negatively impact digestive system health and overall health. Therefore, it is important to review your eating habits and establish a healthy eating routine. You can support me by subscribing to my channel and be informed about my new content by turning on the notification bell.